All right. Welcome to TEA's 2023 Mental Health and Behavioral Health webinar series. So on behalf of the agency, we're glad that you took this hour of your day to join us. So today's webinar is part of our series, and it's hosted by the TEA's Mental Health and Wellness team members. So myself, I am Tammy Kinky. I'm the state coordinator for the Project Aware Texas. We have Ashton Millette, who is our mental health and education specialist at TEA. We have Julie Wayman here with us, who is our director of mental health and behavioral health. So our team works with the supportive schools division on school mental health and safety initiatives at Texas Education Agency. So we initiated this webinar series as a follow-up to our 6th annual Advancing Behavioral Health Collaboration Summit, or we like to refer it as the ABC Summit. So this is a spinoff of that we had in 2022. We wanted to take a deeper dive into many of the topics and resources that we shared during that summit. We had some amazing panelists and speakers there. We also are doing this webinar series to help promote fentanyl awareness and those resources affiliated with that. So we have been convening and using this hour on the second Wednesday of each month at 11 o'clock, Central Standard Time. If you have not been able to watch the previous webinar series, you can go to our school mental health website and you can watch the previous ones there. So I encourage you to do that. And to find the website, it is schoolmentalhealthtx.org. And then you can go to the events and the webinar section there. So today we're going to focus on learning about securing community partnerships to help strengthen school mental health systems. All right, well, it looks like we have everybody onboarded. There's a few that are still joining us. All right, so let's get started on hearing about this great partnerships in this webinar today. All right. All right, a couple of housekeeping things. We are hosting in Zoom webinar format, and so that means that participants can't show their video or the audio. So to ask questions, please use the Q&A function, and that's the best way to get them answered. So as we do this webinar, we're going to be monitoring that Q&A. So definitely put your questions in there, and we'll do our best to get those questions answered. Okay. Today's webinar will be recorded and it will be available on the Texas School Mental Health website. Okay, give us about a week or two to get those uploaded. In your chat box, you can see the link for the School Mental Health website and to see where to get those webinars, past webinars, and then this one as it gets posted. So we will provide CPE credits for educators for today's 1 hour webinar for those who are attending the whole hour. So a CPE certificate will be sent out to the email address that you registered with. Okay. And that's the way to get your certificate. So we will not provide a CPE if you watch just the recordings. All right. So you do have to be present here on this live webinar to do that. So you can also subscribe to the TEA mental health website. I'm sorry, the mental health newsletter by using the link in the chat and then selecting the mental and behavioral health tab. You can also select other TEA topics that interest you, and we'll continue to provide you with updated information throughout the year in the newsletter. Okay. All right, so now I'm going to turn over to Ashton Millette to introduce the session for today.
Thank you, Tammy. You can click a couple slides over. And I just want to make note that we did put the pre-survey link into the chat, so you can feel free to go ahead and do that pre-survey as we kind of like get started today. But again, welcome everyone, and it really is great to have so many of you online for this learning experience. So much like what Tammy said, today's topic is all about securing community partnerships. And we'll start our discussion today by hearing a presentation from Dr. Molly Lopez of the Texas Institute of Excellence in Mental Health, or TIMH, and Dr. Natalie Feekash of the Southwest Mental Health Technology Transfer Center, or MHTTC, phenomenal partners. Then we'll close out today with a panel discussion from several professionals in the field working to reinforce their local school mental health systems through securing community partnerships. So to start, using their extensive knowledge and research, Dr. Lopez and Dr. Feekash will share the importance of strengthening school mental health systems through collaboration with community partners. And before I turn things over to them, I do want to make note of the Q&A function like Tammy mentioned. So you can feel free to submit any questions to the Q&A function, and we'll do our best to respond to them as they come. And if time permits, we'll answer some of those questions with the whole group at the end of today's session. But without further delay, I will turn it over to Dr. Lopez and Dr. Feekash.
All right. Can you all hear me? Perfect. I'm actually going to be kicking us off. My name is Natalie Feekash. I see many familiar names who have said hello and welcome in the chat box. It's an honor and a privilege for Dr. Lopez and I to be here to kick off this panel about the importance of partnering with schools and what that looks like whenever we're working to develop a comprehensive school mental health system. Quickly, my role is to support school mental health at the Southwest MHTTC. And my background is public education. I've worked with several of you who are here, and I'll pass it to Molly just to briefly introduce herself.
Good morning, everybody. It's so great to be here. My name is Molly Lopez. As was said, I'm actually a child psychologist by training, and have the privilege of working with a variety of systems and how to do best practices to support children's mental health. So it's exciting to be here today.
Thanks, Molly. So before we talk a bit about what partnerships look like whenever schools work with agencies within their community, I want to just briefly describe what a comprehensive school mental health system looks like. A comprehensive school mental health system provides a full array of supports and services that promote positive school climate, social emotional learning, and mental health and well-being, while reducing the prevalence and severity of mental illness. It's built on a strong foundation of district and school professionals, so that's everyone in our school district, including administrators, educators, any specialized instructional support personnel, and strategic partnership with students, families, and community health and mental health partners. And I highlighted that piece just to say that they're a foundational piece of building this system from the ground up. And a comprehensive school mental health system also assesses and addresses the social and environmental factors that impact health and mental health within our school communities. Partnerships between schools and community mental health organizations are purposeful, designed to augment the abilities of schools to integrate school mental health into education. Community partners can help to augment services within the school building and can link students to other services and supports in the community. In addition, they can help to champion what schools are doing to support mental health with key leadership, including boards of education and policymakers. We know that successful and sustainable school mental health systems integrate these partners to complement the mental health supports and services already being offered by districts and schools. And the roles and responsibilities of school and community partners will differ based on the unique resources and needs, and what's available within the community. In many schools, community partners are integrated across all tiers of support from tier 1, tier 2, and tier 3, but are primarily involved in more intensive treatment supports for youth with identified mental health challenges. So we've all seen the three-tiered model, but I just want to go a little bit deeper to talk to you about what this looks like. A full array of evidence-based processes, policies, and practices called a multi-tiered system of support, or MTSS, promotes mental health and reduces the prevalence and severity of mental illness. Based on principles of prevention, these tiers of support layer on one another so that students with higher level needs continue to receive supports that promote positive mental health amongst all students. So when we're thinking about these community partnerships, community partners can actually fit into each of the three tiers in different ways. So let's talk about a few roles where our community partners might fit into this school mental health work. The first role that we can think about when we're considering working with community partners is the participation of them on district or campus level teams. This first school mental health teams, their purpose is to serve to coordinate communication, collaboration, and mutual support among individual team members who might otherwise operate in isolation. So they're kind of the group that brings everyone together to make the needed changes to support students. School mental health teams also develop a common vision and priorities for improvement to ensure that the school mental health system is meeting the needs of all students and the larger school community. Finally, school mental health teams can explore how to maximize limited resources to address the mental health needs of students and their families in a systemic, strategic manner. Sometimes those outside entities may be supporting the families outside of the schools, and having that voice at the table when we're working in these teams can really be helpful. A few helpful team activities that we can think about when we're bringing in these community-based partnerships are to identify prospective community partners by obtaining input from school staff, parents, and students through listening sessions, mental health team meeting participation, and/or a structured needs assessment process. Developing a wish list of community partner services or features that would best fit the needs of the district. Drafting a standardized MOU or memorandum of understanding to be used throughout the district. Considering a request for proposals process, and maybe we have several interested community partners that want to be a part of this. Convening community partner leadership on a regular, such as quarterly basis to discuss service delivery and business operations. Working in that partnership can really, as a team, can really help drive the work of partnering with our community partners. The second role that I'm going to talk about before I pass it on to Dr. Lopez is how our community partners might be able to support us in professional development in our school districts. Some example activities would be identify prospective community partners by obtaining input again from what we're hearing from the community, from what we're hearing from the staff. What are specific workshops or teacher or staff workshops that we might want to bring in that maybe we have some subject matter experts within our community field? Sometimes those individuals can provide coaching to our school staff. They can provide spaces for teacher wellness activities. They might be able to help us if there's a critical incident within our community that we might need to bring in additional supports for. And they can also help us when we're working to develop policies and practices in our schools that promote school mental health. They can come to the table and be a part of that process. A few examples of what this could look like whenever we are working with our community partners to develop or to support us through professional development will be supporting those tier 1 services, providing tier 2 or tier 3 services, such as individual support for students, either in group or individual sessions, providing those telehealth services, providing crisis assessments or stabilizations. As you can see on the right side, there are a few examples that we might want to use in our schools, such as coaching on how to develop a trauma-sensitive school, helping to strengthen families through different workshops, social skills groups, trauma or loss groups, or individual counseling. And as mentioned before, mobile crisis responses. So I've shared 2 specific roles that are best practices when we're working with our community partners. One is for them to participate on district or campus teams, and the second, it would be to support professional development. And I'll pass it to Dr. Lopez to talk about the rest.
Thank you, Natalie. So our next role that we want to talk about is our community partners' role in providing school-based mental health services. So really, Natalie sort of covered some of these, but making sure that we think about what role that community partners might have in each of the different tiers within our multi-tiered system of support. And it tends to be, as Natalie mentioned, that our community partners have an increasing role as we get to tier 2 and tier 3 services, but can also be important partners even in those tier 1 services. Next slide. Of course, our next role is around coordinating community-based services. So role 3 was services within the school, but role 4 is really about making sure that we can create great connections between our students and families and community-based services that are available. So examples of those might be helping to coordinate those more intensive services that our students might need that maybe are best provided in the community with our school partners, making sure that we are making those connections and that our school staff are aware of what supports are being developed and are being found helpful within those community services so that we can support our students' success within the school setting as well. It may be that we are coordinating for some of those real specialty mental health programs that are not going to be available within our school systems because we are not having the level of challenges within any one school, but we really know are important for our students to get access to. So as an example, there are specialty programs developed for young people who may develop psychosis symptoms, which typically do develop in adolescence and young adulthood. Our schools are not likely to offer those on campus, but it can be really important that we are aware and have those partnerships in place so we can make sure our students are able to access those services. And additionally, making sure that those partnerships can help us support transitions from higher levels of care, such as hospital-based care or residential care that a student may be involved in, that we've got those partnerships in place so that that student's transition back into the school can be as successful as possible. So one of the things that Natalie mentioned that can come out of even a needs assessment is thinking about, as a school or as a district, what do we most want and need from our community mental health partners? So going into that with that awareness can help us establish the right partnerships and talk through from the beginning about what those needs might be. So example things that might be a part of that wish list is wanting to make sure that folks from that provider can participate in our school mental health teams and be a part of that team. Maybe we know specifically what some services or supports are that we need at tier 1, tier 2, or 3. Perhaps we know that social skills is an important tier 2 service that we want to provide. And so we want to look for our community providers to be able to support those needs. We might want to make sure that they are offering evidence-based practices and that the practices that they are using are appropriate for the culture and the language of the families that are in our schools. We might want to make sure that they are collecting data and that they can provide data back to the school about how the services are impacting the students and families. We might want to make sure that they can offer professional development or supervision and support within our school. We might want to make sure they are partnering families and can support that partnership when they are providing services on school, that they're able to bill both Medicaid and private insurance so that we can maximize the funding supports for the services that are provided to students, and that they have knowledge and experience in working in schools, that they understand the school culture can be important things to think about. All right. And so one of the things we wanted to do was to quickly sort of summarize what has come out of the field as some of those keys to successful collaboration between communities and schools. The first one is that there is a team, a leadership team that includes both the school and the community partners, that those members are meeting regularly so they can really have discussions about what's working. They can build that shared leadership and responsibility so that everyone knows their roles and how they're contributing to that school mental health system, and can build trust and understanding of what each partner can do and how they do it. Also, another key to success is really doing that needs assessment that Natalie talked about. Building those partnerships based on what we understand is needed in the school. What are those most pressing needs? Can be a really important part of both knowing who to invest that partnership in, but also to be able to communicate that to those partners so they can build services that really meet the needs of the school. The next one is about designating a partnership coordinator, somebody within the district or school who can be accessible to those community partners and help navigate when there are barriers that they run across, because that will happen. So having that communication flow is super helpful. And then making sure that we have clear expectations and really shared accountability systems for both the school and the community partner, that we really truly have communicated what we expect from our community partners and how we navigate and understand the impact that the partnership and the services are having on students and families. And then lastly, that we evaluate the quality and the impact of those services. And I say that knowing that that is a challenging thing both to do, but also really to develop that culture where we talk about what's working and what's not. And we open our data up to our partners and let them see where things are working and where we might be able to improve. Definitely takes a level of trust to make that happen, but it really does strengthen that partnership and allow for those shared values and shared work to do the most successful collaboration with you. And then, as Natalie mentioned, our last kind of key is around creating, co-creating policies and procedures, communication materials, having those partners involved in what gets communicated to students and families about the mental health services that are offered, as well as maybe helping to make sure that our training materials are really aligned across our different partnerships. All right, I think that is our last slide. So I hope that is helpful. I want to say, as I pass it back over, that I'm going to drop in a link into the chat that has a variety of resources around school and community partnerships, including some about partnerships with higher education, which I think is really exciting, that I want you all to have.
I already did that while you were speaking, Dr. Lopez. So
Thanks, Natalie. I'm going to redrop it because it's already set up in my system.
sure.
I can have it twice.
Right, the more the merrier, the more the merrier. Awesome. So thank you, Dr. Fikash and Dr. Lopez, for sharing all of those like really awesome and important tips. I will like to mention and make note of again that both this recording and that slide deck that our partners just shared will be posted on our school mental health tx.org website. So if you're like furiously jotting down notes or didn't catch anything, it is okay, because this will be recorded and the slide deck will be shared as well. And as Tammy kind of like shared, pulls up our slide deck again, I do want to make note of all of the resources that Dr. Fikash and Dr. Lopez put into the chat. And I'm also dropping another link into our chat to our school mental health tx.org website in the toolkit. So we had a couple of questions around like a sample MOU or even the wish list. And you can go ahead and find some of those resources as well in that toolkit. Awesome. So we're going to transition over to our panelists. So, we've gotten some really phenomenal tips from TIMH and MHTTC. But like many of you, we are definitely interested to see like how are these tips and like these best practices being implemented in the field by people like you all. And so we have some really phenomenal professionals from all across the state that are really working hard to bring in their school communities to strengthen their school mental health systems through community partnerships. They'll share their models of securing community partnerships and their lessons learned along the way. We were recently talking about how we are covering the state, right, all the way from Wichita Falls down to Galveston and even into the border region as well. So without further ado, we'll go ahead and get started with the panel. And I'll actually start off the discussion with Dora Maria Ramirez from SCAN. Tam, you can go ahead and stop sharing the screen now too, if you can. Thank you. Yeah, so like I said, we'll go ahead and start off with Dora Maria Ramirez from SCAN. And I just wanted to ask you, Dora, go ahead and share a little bit more about your role and what your organization is doing to strengthen school mental health in your community in Laredo.
Okay. Can you all hear me?
Yes, ma'am.
Okay, I do apologize. We have a light issue here. There's no light in my office, but there's light on the outside. So again, thank you for the invitation. I am Dora Maria Ramirez, and like Ashton said, I want to thank each and every one of you for the opportunity. And most of the things that I was looking when both doctors were sharing, it's like, wow, those are some of the things that we do. So my role here in the organization at SCAN, that's serving children and adults in need, I have like two dual roles. My role is I am a drug prevention services coordinator, and I work with all prevention directors here who oversee some programs in both Region 8 and Region 11. My other role that I do here is I constantly have contact with both school districts. We have two school districts in Laredo. We have Laredo ISD and we have United ISD. And so my second role here is I am now the new program director for the SCAN LISD Aware project. And so we're excited because we're going to continue bringing more mental health awareness and resiliency among the youth that we work. In the past, I was overseeing two of our youth prevention programs, which is a YPI and a YPS. And with that, we are very specific. We can only work with a middle school and we can only work with a high school, and we have only certain numbers to work. So with the SCAN LISD Project Aware, we're going to be able to work with the youth, their parents or family members, and all employees of Laredo ISD. So we're excited with this because we're going to be implementing the 3-tier public health model, which you all broke it down to and explained it very well, and which includes the universal and selective, and obviously the tertiary, right? So our thing that we're doing now, we just recently had our first advisory board meeting. It was last month, and we have our partners, which is Laredo Independent School District, the TEA, HHS, Region 1. We have our evaluator who's on board. We have the mental health and the IT support from UT Texas. And so we're currently working on the needs assessment, which we should be completed, we're thinking sometime in May. So obviously, we want to make sure that we have the strengthening to move forward this mental health awareness. So for the second one is, you ask about how do we collaborate with the district and community partners? Well, one of the things that we do constantly in an ongoing basis, we want to make sure we're constantly promoting our program services. Knowing another key point would be you need to know the directors of guidance. This is something that we feel has worked for us. Knowing the directors of guidance and counseling for both of our school districts, we want to make sure we get to know our principals, truant officers, our attendants, clerks, our coaches, our parent liaisons. They're key people because they're the ones that come in contact with the youth that we're working for. We want to also take part in different coalitions. We try to take part in any coalition that's available. They invite us to stakeholder meetings. We participate in the PTOs and the PTAs, health fairs. We want to make sure we promote our programs so we can generate some of those referrals. And then like in my case, both guidance directors, I've been at the agency for 27 years, and I've always had contact with one of the primary guidance director, which is Laredo ISD, with Miss Silva. She participated on a ABC Summit. But I also, what I do when I make contact, first point contact with anyone, I do give my cell phone number. I give them obviously my office number and of course my email. And the reason I do that is because I go in and out of the office most of the time. And so if I get a call from one of the counselors or from one of the counselors having a parent there, and they need to make a direct referral or link them up to a community resources, I can be that linkage. And if I don't have that information, I can refer them to the right information. But it's very important to stay in touch with all schools, right? Visit the schools regularly. This is something we do. We do it on an ongoing basis to promote the agency, to promote the programs, and obviously to deliver evidence-based practices and referrals. And then obviously to make sure that the curriculums that we choose are targeted to the individuals that we're working with.
Right.
And the last thing, I'm sorry, Ashton, I'm sorry, am I going too fast?
Oh, no, ma'am, you're good. You're good.
Okay, because I know I have a few minutes. So, and so the last thing I would like to share is what are some strategies that we use to formalize our community partnership? And you all mentioned this already. And one of the things that we do is our strategy is we always renew our MOUs. We renew them on a yearly basis. And what we do is we have to present to the school board so that the superintendent can sign that MOU. And even though that MOU is designed to be open to all of the schools available, elementary, middle, and high school, we still take the time and go in individually to each principal. We present our program again, talk to the counselors. And so this is something that has helped us tremendously because the principal that was there last year might not be this coming year. So the renewing of MOUs has been a tremendous help. The other thing that we do also is we tend to invite those key people that we call the champions to our stakeholder meetings. We keep them involved in our program services. We talk about the new grants that are coming in. If new programs have been added, we want to make sure those key people are aware, plus everyone else that's out in the community. We want to make sure that this is the services that are provided. Most of our services are free. And for example, when the Project Aware grant came out, we reached out to both of our school districts and we asked them, are you going to be applying for this grant? And they told us, no, I don't think so because of time constraints. And then we asked them, if we were to write the grant, would you collaborate with us? And immediately Laredo ISD jumped in and said, yes, we'll be your partner, we'll support you, and so forth. So we try, and obviously the goal is always to sustain these programs. And in many instances, we had the buy-in from our local government. We had the city of Laredo that donated one of their buildings so that we can continue with this one grant that was ending. So we didn't have to pay for rent. So I don't know if I went too fast or y'all.
No, you're good, Dora. Thank
Okay.
you. Thank you so
All right.
much. I wanted to point out something too. We had like somebody in the chat mention, how can we like be able to get buy-in from our, like our campuses and district personnel, especially with partners. And one thing I do want to point out that you mentioned, Dora, is you are very active around the districts and around the campuses, making yourself seen, making sure you're touching base with folks. You're on top of knowing, when staff has a little bit of turnover. So that's a really good point that you mentioned. So thank you for sharing that, Dora. Cherie, you are very similar in terms of being a community partner with the Causeway Galveston Initiative and Galveston ISD. And I just wanted to create some space for you as well to share what your role is and what Causeway Galveston is doing to strengthen school mental health and GISD.
Yeah, thank you, Ashton. I'm Cherie Spencer. I am the district SEL coordinator for the past 5 years. And my role is kind of twofold as well. I lead up a team of 7 SEL specialists who are here in our district that are on campuses supporting on the tier 1, tier 2 level. But then I also work as the partnership coordinator. And with that, our partners are Teen Health Center, which provides mental health supports here within our campuses, Family Service Center, who provides mental health supports here within our campuses as well, and UTNB Center for Violence and Prevention, who is our evaluation leg. So you talk about that quality improvement, the continuous quality improvement, they provide that for us. And one thing that I've noticed with our model is beforehand, we were kind of working in silos. So Teen Health might have been in our building, but they were working alone. Same thing with FSC. And so once we kind of came together as a collaborative, we started to knock those walls down and really communicate with each other on how we can best service the district as a whole. And so we come together on a weekly basis. It's called our design team. And so the directors of each partnership come together and we talk about what is going really well here in the district when it comes to incorporating mental health supports. What barriers are we coming across? And then how can we solve those barriers? So it is a weekly basis meeting that we come together. And from that, we have now started to work together. The silos have been knocked down. They are learning a lot about the school environment. We're learning a lot about the mental health environment and their needs. We do have MOUs signed with our partners, which has made it really, really helpful that we could talk about kids. We could share information within a certain area, you know, but that is kind of what we're doing. And we're using that MTSS model to hit all tiers 1 through 3. So the SEL specialists focus a lot on adults, coaching, training, supporting kiddos, where our Teen Health and our FSC really focus on the tier 2, tier 3, providing groups and individual therapy here in Causeway Galveston. And I know I've got more to share, but I also know there's 2 other questions that I'll get to share those pieces. So I'll wait on.
Can one like real quick follow-up question? Can you name the partners? I know you kind of mentioned like FSC. Can you name kind of like some of the partners that you all have with Causeway Galveston Initiative? With the Causeway
Yeah,
Galveston?
so yeah, Causeway Galveston is the name of our team, our partnership. So under Causeway Galveston is Galveston ISD. That's now partnered with Teen Health Center. That's partnered with Family Service Center, and then UTNB Center for Violence and Prevention. So those are all the partnerships that have come together underneath Causeway Galveston to establish that tier 1 through 3 supports for mental health for our kiddos and our adults here in Galveston.
Awesome. Thank you.
Yeah.
Thank you for sharing that, Sherry. And then now we have Jonathan Cogburn from Education Service Center Region 14. Jonathan, real quick, can you also tell us a little bit about your role with the ESC region and how you're able to support the school mental health systems of the local education agencies that you work with in your region?
Absolutely. So at Region 14 Service Center, I have got 2 roles that kind of overlap for student mental health in a lot of ways. I am the lead consultant for our small and rural mental health grant. And under that program, we go out to 6 schools here in our region. And this year, what our teams have wanted more of is some tier 2 intervention. So we prepared a monthly training for them. We drive out to them in person, and we provide them in training and some direct intervention strategies. That's been a lot of our activities this year. We also, shout out to my partner, Dina Riggins. She and our House Bill 19 liaison are out at one of our districts today doing a lunch and learn for some parents. So we're connecting our House Bill 19 person up with some of our schools to help her be used as a resource by schools and families. We have on the McKinney-Vento side of things, one of the things I do is provide some educator wellness and burnout prevention training segments in our quarterly meetings. The district McKinney-Vento liaisons that serve homeless students, they have a quarterly meeting they're required to attend, and but we want to make part of it for them. And so that's been a really enjoyable activity for me. On both sides of that, the smaller rural mental health and the McKinney-Vento work, I help the liaisons and our mental health teams find resources for tier 3 for therapy in the community. I came from the private practice world just a couple of years ago and have a lot of community connections, other therapists that I know or agency connections that I have from that time. And so I'm working to keep those connections alive and have some really strong referral network relationships. And I've been able to help school counselors and families find therapy on both sides of that work so far. I think that's a pretty good summary.
Awesome. Yo, thank you so much, Jonathan. And I do want to mention that House Bill 19 person, right? That is our non-physician mental health professionals, right? That are housed within the ESC regions that are also like connected to the local mental health authorities in the regions as well. So thank you for sharing that. You're doing some phenomenal work. And to round us out all the way up in Wichita Falls, I want to definitely welcome Christina McCrary from ESC Region 9 and her colleague Jessica Hoffman, a school counselor from Windhorst ISD. So Christina, can you go ahead and tell us about your role and what the ESC 9 mental health initiative is?
Yes. Hi, my name is Christina McCrary, and I'm the coordinator for the Mental Health Initiative here at Region 9. Our region is pretty unique in that we are mostly comprised of small and rural schools, and they're pretty spread out across our area. So with that, a local philanthropy agency approached Region 9 and said, we would like to help provide mental health services for our region. How do we go about doing that? What's the best, most effective way to do that? So we put together a model that uses existing district supports and trauma-informed practices and trauma-informed care that would allow us to hire 9 local licensed mental health professionals. So we have mostly LPCs, we have a couple of LFTs, and we are also bringing on a classroom management specialist to help our small and rural schools. So more than half of our schools either don't have a counselor at all, or they have very much less than the recommended number of counselors. And most of that is because of funding, and we are a very conservative region that is just really getting into mental health issues. So really our school districts, including Windhorst ISD that Jessica serves as the school counselor on, are really utilizing this program and the trauma sensitive approach that we have. We're using the SHAPE system model as a model of measurement for those districts, and also bringing in a third party evaluator to evaluate the efficacy, and really kind of tying that in with our trauma informed schools training, trauma sensitive schools training, bringing in our local mental health authority and having a continuation of care agreement and releases for our counselors to talk to the counselors at the local mental health authority, and providing individual and group counseling for our teachers and staff members at the schools that we're serving. We are in 26 campuses right now. Keep in mind, some of those campuses are K through 12, and then other campuses are individualized by elementary grades and secondary grades. But really, we've been able to provide a lot of really great help for our districts. We had nearly 300 referrals for students and staff members last semester. So that just really goes to show the need in our region. And I know that's not just for us, that's everywhere. But I think that our region is really coming into a mental health awakening of, we have got to provide the help. We've got to meet our students and our teachers where they're at. And we're really blessed to be able to provide this opportunity for them.
Right. Thank you for sharing that, Christina. Jessica, I know, as a school counselor, especially, being in such a rural district, I know that the support from the Region 9 Mental Health Initiative is something that's like much needed for you all. And I guess my question for you is, what impact has ESC 9's Mental Health Initiative had on students and families on your campus?
Yeah, absolutely. It's been invaluable for me. I'm in a very unique situation. I'm in a small 2A rural school district. I am the only counselor pre-K through 12th grade. So I am responsible for serving 523 students and about 80 staff members by myself. And in my school district, up until last year, they did not even have a school counselor. So I'm the first school counselor that they've had, and this is my second year. I've had many years experience in school counseling, but it's unique to step into a situation where staff and students and the families are not accustomed to having mental health support at school. So it's been a huge transition. You can only imagine what my workload has been. We've had many crisis situations, unfortunately, occur in the community. And, you know, last year it was solely on me to kind of offer that support. And so it was very overwhelming. And so when Christina offered this service, I was like, oh, absolutely 100%. My only complaint would be I need her more. So, but I do have an amazing mental health specialist that comes to our campus 1 day a week. Within 1 week, her caseload was already full. She already couldn't take on any more students, but being in the rural community, our closest, mental health support specialist outside of the school, there's such a long wait list. We can't get students in to see them. And then they have to miss almost a whole day of school because the commute to get there, parents have to take off work, the commute to get them back to the campus. So just having someone here on campus, I found that the families are a lot more open to getting support when they know it is someone available here at school, free of charge. The students are able to be pulled when it works best in their schedule. The parents don't have to take off work to get them here. So it has just been invaluable. And just for me personally to being the only counselor, to have someone there to support me and the resources she can provide to me and we can collaborate, that has been invaluable as well.
Wow. That's so impactful, right? Like just the gaps that having this community partnership has been able to fill, especially in that small and rural side. I also want to make note for the audience that each and every one of these community partners here have not only mentioned about how they're serving students across all 3 tiers, but also how they're being able to support the adults that are really out there educating our students as well. So I think that's like one of the big things that I'm kind of like taking away myself from you all. And I know we're running low on time and we had like so many questions. But what I will do is kind of like round us out with just like a quick whip around to make sure we all kind of like get one little last thought. So just real quick, I guess like to start off with Cherie, like what are some programs or even like some very much so evidence-based interventions that you all are using with the Causeway Galveston project, and then kind of like round us out with any advice you might give to the folks in terms of securing and formalizing community partnerships themselves.
Yeah, no, thank you. And so, yeah, we do have the therapist here on campus servicing some of the evidence-based practices that we're utilizing. We definitely use CASEL's framework to kind of guide our professional learning and our coaching. We've utilized Second Step, but something that we found with Second Step and having our campus-based meetings, which we have once a month with the school leaders, the counselors, the therapists, the directors, myself, and we talk about what the campus needs are. And kind of differentiate our services based on each campus, kind of like you would do for a child. One thing that we've noticed is teachers are saying, we don't have time to do this. But then we've also heard principals saying, we don't have time not to do this. And so they've started to incorporate it within their schedule blocks. So we have Second Step, but something that the SEL team has done a fabulous job with is they have, because they're all teacher certified, they have created lessons for there's 5-minute snack size lessons, there's 10-minute culture talks, there's a 15-minute morning motivational Monday. So there are lessons created by teachers for teachers. And we have really seen that be utilized a lot more. And UTMB does our focus groups at the end of each year to kind of bring in that evaluative piece. And that is something that teachers that we have found, like lessons learned, that teachers have said tailoring those SEL activities and lessons to different campuses have really helped with the movement, and they've seen change in their kiddos and they feel comfortable doing it. And then another thing that educators have said is that SEL is helping education administrators address high stakes student needs. So we are doing those things and then kind of strategically placing our kids into support systems through our A teams, which is our therapists, our SEL specialists, our CIS member, counselors all coming together to talk about kiddos on each campus and where do they fall in the tiers and what exactly are they needing. So yeah, and then just to wrap it up with our wish list, because we just finished up our focus group from 2022. And so we kind of got some data from that. And their wish going into next year is just having more SEL training for all adults. They've seen the impact of that. And we've had our partners come in and help provide that training and kind of put in that mental health lens for us. And then more support and consistency with the integration of SEL and mental health across the district is a want of theirs. And then more SEL and starting in the early students' school journey. So really starting when they're young. And so we're also kind of looking for future funding. As great as this is, we're also coming to the end of our funds. And so kind of working with this partnership on how can we sustain it, whether it's going for mental health funding, for different educational grants. So that is where we are now, but it's been a really great experience, and our kids are taking it all in. We've already received 594 students have been serviced, and that was just in the first semester.
Wow. Nice. I mean, that's talk about impact, right? Got the numbers to show for it. So thank you for that, Cherie. And again, like just quick whip around for like just last kind of like parting words from y'all. Jonathan, I know one of your skill sets is around like being able to get creative, right? Given especially like your expertise and your professional background. So for the audience, right, like what's some of the advice that you give some of the LEAs that you work with around this topic that you would like to give our audience as well?
Absolutely. So one of the first things that kind of started to happen naturally, I mentioned helping our school staff with referrals. I just kind of naturally started giving them advice based on having worked in some different counseling clinics and knowing what the inner workings of those places feel like. And I wanted to share a little bit of that with y'all. Whenever I'm given a referral to one of our school district mental health team members or McKinney-Vento liaisons, I encourage them to look for at least 3 or 4 names that fit the needs of the student. 3 or 4 names of counselors in this case. We're helping them find therapy. And I try to get at least that number. I encourage them to get on all of the waiting lists of those 3 or 4 providers and to take the first available, because that can be a faster way to get help. And we find that if somebody sits on a waiting list too long, they lose motivation and they kind of fall out of interest of getting the help. So if you can do that front end work, it can help you get in a little bit quicker. You can encourage your parents that you're working with to get access to therapy to be the persistent squeaky wheel. The front office staff in those counseling clinics are oftentimes people who are working on their own counseling certification process, or they're in school for it, or they have an interest in people helping. And if you call, once every week, once every 2 weeks, and you just say, hey, this is so-and-so's parent, has there been any movement on the wait list? Do you have any last minute appointments? Those front office staff in those clinics will want to help, and they'll go and oftentimes tap the shoulder of those providers and go, hey, this person seems really motivated. That's a very attractive thing to that provider, because we know we're going to be able to move faster helping somebody who's fired up about getting in. That's a really, really powerful thing. One other thing that I will tell you about, I'm excited about, we have a partnership through the Rural Utility Service grant, which is a USDA grant, that just provided us teletherapy equipment. That's all it's paying for. And then we went out and got MOUs with Abilene Christian University and Hardin-Simmons University and our mental health authorities in the area to provide teletherapy on site at our schools. And that's a really awesome thing. The equipment's paid for. One point I want to make about that is The only cost of that grant is the equipment itself and the Zoom licenses. If you have those already as a district, what's to stop you as a district or as an ESC from going out and finding a university that's training master's level clinicians and forming a similar partnership to help deliver service within the schools? Another great thing about that partnership, it's for staff and for students and any presenting issue. It's a great way to combine grad students who need therapy hours with community members who need therapy who are far flung.
Yes, sir. Thank you, Jonathan. All like
Yes.
talking about creative, right? Using utility services grant, right? And kind of like positioning that with some MOUs to be able to like provide telehealth services, essentially, kind of like creating your own little telehealth service. And then to round us out, Christina and Jessica. Christina, can you kind of like give some parting words of advice around like whether it's, you know, securing funding or, you know, formalizing those partnerships? And then Jessica, you can kind of wrap us up with just like from the campus-based perspective, getting that buy-in, any advice around that. So you can go ahead and start as Christina, and Jessica, you can round us out.
I see one of the questions in here is about informed consent, and I wanted to touch on that for a second. Our LPCs and LMFTs do require informed consent. So we developed that in-house and in conjunction with our legal team. And that goes out to parents before, you know, we obviously have any contact with the student, in order to reach out and talk to any of the mental health providers in the community that our students may be wanting to receive services from or have previously. Obviously, we would need a release of information. One of the big things that has helped us, you know, really build a foundation of this program is having the data to back up what we're doing. We're able to show the growth, not just for our program, but for these individual districts. And from that, those districts are able to take that data to their school board, to their committees, like their SHAC committees, to their decision makers on their campuses and say, hey, we obviously have a bigger challenge than what we even imagined. So that's allowing those districts to say yes, to delegate some of that funding for a part-time counselor or for a full-time counselor or an additional counselor, or really even looking at the issue where as they may not have even looked at it before. So I think that's been a really big part of it. And, you know, Jessica, I feel like maybe that's part of it for y'all too. The buy-in is really backed up by the hard data.
Yes, Christina, you're exactly right. And what I found is like, when I first got on, we did develop a mental health team, and I found those teachers out there that I knew, you know, were on the front lines and understood the importance of the whole child and the social emotional support. So I developed my team from them, and then I used them as advocates to go out to their, you know, their colleagues and things like that. And then all of last year, I spent majority of my year just collecting data throughout the entire year. And at the end of the year, I created an end of the year report, presented it to the superintendent and the school board to show, okay, I know this is our first year to have a school counselor. Here's what I've done. Here's the numbers. Here's the services that I've provided. And when we were able to put that in perspective and then see that data and those numbers, they realized that even though we are a very small community that has not had the mental health support, the need is definitely there. And so it's very important to do my time analysis and to collect my data and show what I'm out there and what I'm doing, that I presented to the school board and the superintendent, and then obviously get the buy-in from the teachers, and then they were all on board too. So
thank you. Thank you to each and every one of you for sharing and taking the time out with us to be so impactful and share your knowledge all across the state. I saw some things mentioned in the chat about like wanting a little bit more information and loving all of the things that you were mentioning. I do want to say to everybody, like, stay tuned. You might be able to see these folks again in another capacity with some other events that we might have going on. So definitely stay tuned for that. You might be seeing them again. Again, thank you all so much for all of the time that you have dedicated to us. I know we are at time right now, so you all are free to go. But if you would like to stay, I will turn it over to my colleague Tammy to kind of mention a few more housekeeping things. Please make sure you do our post survey as well. But again, thank you to each and every one of you for joining us as panelists today and sharing your knowledge and your lessons learned. Thank you so much.
Wow, thank you all. What a great set of panelists that we had today. As a reminder, the recording, the PowerPoint, the any handouts, any presenter information will all be posted on the schoolmentalhealthtexas.org website. So please look there. I have added the post-training survey link into the chat box. If you would please complete that survey for us, that would be much appreciative. There are also fentanyl awareness resources that were placed into the chat box. So please check those out also. And with that, we conclude another round of our wonderful webinar series. Our next webinar will be held and we will discuss TChat. So I know TChat was alive and well in the chat. So please join us next month for that amazing webinar.